Good evening, everybody. Thank you very much for taking the time to join us for this webinar this evening, which is hosted by AHDB Beef and Lamb. My name is Mary Vickers, and I'm Senior Beef Scientist for Beef and Lamb within AHDB. We're delighted to bring you tonight's webinar entitled Responsible Antibiotic Use on Beef Farms. Part of the reason for doing this vet-targeted webinar is that we're looking for vets to work with us to deliver some farmer meetings this winter on this topic using the presentation that Alex has developed. So if anyone's interested in this opportunity, then please email brp@ahdb.org.uk, and I will say that again at the end of the webinar. The slide pack will be made available to everyone, so you do have the opportunity to use it for your own meetings with clients and that sort of thing, as long as you maintain the recognition of AHDB as the source of that material. So our presenter this evening is Dr. Alex Corbishley. Alex has practiced as a farm animal vet and is currently lecturer and researcher at the University of Edinburgh. So the plan of action for this evening is that Alex will take you through his presentation, and then there will be some time for questions and discussion at the end. You will all be muted throughout the webinar, but if you've got a question, then there's a box on the right-hand side of your screen, and if you type your question in there, then I will ask Alex those questions at the end. There shouldn't be any technical difficulties, but if there are, then do bear with us. I think that's all I need to say at this point. Without further delay, I will hand over to Alex.
Thank you very much, Mary. So as Mary said, and just to stress, what we've tried to do is to produce some slides that you can use at farmer meetings over the winter. So some of the content in these may be well-trodden knowledge for most vets, whilst other stuff may be new. And then as we get later on, there might be things that stimulate some discussion later on. We're hoping to last between 30 and 35 minutes on the slides to provide plenty of time for discussion. So I guess the first thing really is understanding why there's so much attention on antibiotic use in farm animals and then also in the beef sector. And the structure of today's presentation will be to talk about antibiotic use in farm animals and that implication that they have for human health. So look a little bit at the key actions we can use to drive responsible use. Look at the drivers for antibiotic use in sort of 3 typical beef type systems. And then to finish off, really looking at where some of the easy wins are, and then maybe some of the longer term actions needed to drive down use within the sector. So why is antibiotic use under the spotlight? I would have thought most people will have now seen this infographic that came out of the O'Neill report a few years ago, and that predicted that antibiotic resistant infections in humans are going to cause around 10 million deaths by 2050, rising from around 700,000 deaths at present, and that therefore the global burden of antibiotic resistant infections in humans is going to be substantial. And a major recommendation from this report was really to look at antibiotic use in all systems, so in humans and in animals, and really to drive down use in both human and veterinary medicine. So when we look at antibiotic use in agriculture, again, this is probably familiar to a lot of you. Where does the United Kingdom sit? So this again was taken from the O'Neill report, and you can see predominantly EU countries, with a few others shown in as a comparator. So you've got the USA here and New Zealand, for example, and the UK sits slap bang in the middle of that distribution. And this is measured on a milligrams per kilogram. So that's milligrams of active ingredient per kilogram of livestock biomass at a national level. So the UK isn't a particular outlier, but it's certainly not within the group of very low users when compared internationally. So what about since then? What sorts of numbers have we seen? And what is the trend of antibiotic use in food production in the UK? So looking at 2014, which was the year just before the data I've shown you, we were up at about 62 milligrams per kilogram. And it appears to be that we're looking at a general downward trend, and we're now below the 50 milligram per kilogram initial target that was set for the industry in 2016. Now we'll talk about the highest priority critical important antibiotics later. However, it's always important to look at these metrics separately to the overall use. And the obvious reason for this is that the dose that we use of the critically important antibiotics is much, much lower than the older antibiotics, such as the tetracyclines, the penicillins, and the trimethoprim sulfonamides. So when we look at usage just of the critically important antibiotics, total usage in 2016 was 45, as we can see above. But if we look at the critically important antibiotics, we're at a different scale, we're at 0.24. And therefore, the important thing here is looking at the trends of these different classes individually. And again, it's a similar sort of good news story that across the fluoroquinolones, the third and fourth generation cephalosporins and colistin, we've seen a significant reduction over the past 2 to 3 years of data collection. So the general picture is one of good news, of declining use. And in terms of discussing this with farmers and clients and trying to understand the broader implications, it's linking usage to resistance and how that resistance is important both to animal health and to human health. And of course, a lot of clients that we still talk to will see the animal as the thing that becomes resistant following the use of antibiotics. And they often don't really associate the actual bacteria, the bugs themselves, becoming resistant. And that's an important part of the discussion, because it's only once they've sort of really thought about it's not the animal, it's the bugs inside the animal that are resistant, that then the real implications for contamination of the environment and also therefore bacteria coming through in the food chain become obvious to them when they're thinking about it. So resistance has existed for millions of years. It's existed pretty much since as long as antibiotics have been produced by bacteria. So it's always in the animals that we're treating, it's in the environment, it's in the food we eat. But of course, when we come in with an antibiotic product, we remove the non-susceptibles and we then create space within the biomass, within the microbiome of that animal for those resistant bacteria to proliferate. And then the important thing when talking to clients is then making that link between these bacteria in the animal and then those that spread into the environment, into the water courses that we might be swimming in or drinking, or coming through in the food. And the other concept that we often have to discuss at length is realizing this applies both to our commensals, so our good bacteria, and our pathogenic harmful bacteria. And why that's important is of course related to the transfer of resistance genes. So again, going back to a lot of the things that we will have worried about at undergraduate level, but reminding farmers that you've got these good, our commensal bacteria that live in our intestinal tract and in the skin, and use of antibiotics will select for resistance in those, and that's not really going to cause us any bother. Those bacteria are not causing disease, but they will acquire plasmids that allow them to become resistant to antibiotics. At the same time, either within the animals we're treating or within the population of animals or within a human, we will have harmful pathogenic bacteria that could be pathogenic to animals or humans or be zoonotic. And they may well be susceptible to antibiotics. And the real concern and the real thing that's driving the priority to reduce antibiotic use in farm animals is this transfer of resistance from our microbiome, our commensal organisms, into the pathogens to then result in a pathogen that's resistant to antibiotics. So the commonest question we get asked when thinking about this and talking about this is, how often does this occur? And it's a very difficult question to answer satisfactorily. There are various numbers that are banded around. As an industry, we are generally of the view that the vast majority of problems in terms of pathogenic resistance in humans is related to antibiotic use in humans. But it's important that we're aware of all of the literature in the field, and this has been quite an influential paper that came out a few years ago now in Nature, where they did pairwise comparisons of gene transfer between bacteria that were found in different places. So they looked at bacteria that you might find in the marine environment or in a hydrothermal vent, or bacteria that you might find in the nasopharynx or the gingiva or the gastrointestinal tract and skin of humans. And they asked the question, how often do genes transfer between these different environments, between these bacteria from these different environments? And what they've produced here is a heat map. And the more blue it is, the less gene transfer it is, down here at 0. And the more red it is, the more gene transfer there is, with black representing a lot of gene transfer. So that's 10.6 transfer events per 100 comparisons that these scientists made. And on one side of this line, so on the top half, we've got all genes. So this is the rate of transfer of all genes. And down here, we've got the rate of transfer of just the antibiotic resistance genes. And the first thing that's very striking, you can see that the bottom half is a lot more colourful and less blue than the top half. So antibiotic resistance genes move a lot more between bacteria than the non-antibiotic resistance genes, or all genes. So I've highlighted here at the bottom transfer of antibiotic resistance genes from bacteria, from the food or the farming environment, and then up here with humans. And you can see that we've got a lot of orange and red here. So actually, even though the majority of disease, antibiotic resistant disease causing bacteria in humans have probably evolved due to antibiotic use in humans, the rate of transfer from the food and farming reservoir of resistance through to the human microbiota, through multiple body sites, is relatively frequent. And I'm introducing this as a slide that most people probably wouldn't choose to present to a group of farmers, but just as an illustration that there is evidence out in the literature that this gene transfer does actually occur quite commonly. So is there any experimental evidence to back that up and to really show whether this can happen through the food chain? So it's amazing what you can get a group of students to do when they get paid a little bit of money. And this was one study that was published again a few years ago now, back in 2006, where they took 6 students who volunteered to drink 2 harmless strains of bacteria. And one was a donor strain, which was an antibiotic resistant bacteria from poultry. So this was a poultry Enterobacter that had developed resistance in a poultry system. They also, just after that, drank a recipient strain, which was an antibiotic susceptible bacteria that had been isolated from humans. So it was Enterococcus again. So they drank these 2 bacteria, the resistant ones and the susceptible ones. And they gave a fecal sample to the researchers every day. And as you'd expect, within a day, you started finding the donor strain coming through these volunteers. And again, as you'd expect, within a day, you started seeing the susceptible recipient strain coming through. And down here, what we can see are the bacteria that have acquired resistance. So these used to be the susceptible antibiotic recipient strain, and they've actually acquired resistance from the donor strain. And you've seen that happen here in 3 of the 6 volunteers after 1 to 2 days. So again, hard experimental evidence showing that you will get transfer relatively frequently between antibiotic resistance in our food and the bacteria that within our own microbiome. So if we look at the literature, this is again one of the main points made by the O'Neill report. They looked at a sort of 114 papers that supported limiting the use of antibiotics in food production, and about 100 of those came from the academic publishers. And they only sort of found 15 papers that argued against limiting use, and half of those were funded by industry, and half of them were published by academia. So the implication being that the general impetus within the field is to limit use of antibiotics in food production. So that leads us on to being a bit more practical and considering, what do we really mean by limiting use? And within the UK, we're as an industry, we're very much against this concept of antibiotic free. We're concerned that that's going to limit treatment to animals that are in need of treatment and actually make things worse with respect to controlling infectious diseases and animal welfare. But we do need to be talking more to our clients about responsible use. And in terms of the rumour definitions, we're talking about using medicines as little as possible, but as much as necessary. And what do we mean by as little as possible? Well, this is really trying to reduce disease risk. If we can manage diseases more effectively, if we can address the issues in our management systems that mean that we're more at risk of disease, then we can automatically reduce the amount of antibiotics we need to use. And by implication, we therefore shouldn't be using medicines as a substitute for good farm management. Yes, using an antibiotic is a lot cheaper than changing the building, but actually as an industry, we need to be looking at these better ways of managing animals to ensure that we're not relying on antibiotics to make our system viable. But when we're using them as much as necessary, our clients need to ensure that they're both following the label and the veterinary instructions they've been given. We need to be sure we're using the correct dose and courses, and they're observing their withdrawals properly and storing them properly. And on many farms, we know these are ongoing issues with the way medicines are being used and stored and administered. So the real message to producers is that as little as possible as a concept should be a win-win situation for them. When we're using antibiotics, we're using them to treat infections when we've already had losses within our system. So we've already incurred a loss. And the other important point for them is that the medicines are only a relatively limited part of the overall cost. And granted, these numbers are a little bit old now. This is Tony Andrews' paper from 2000. But looking at the cost of pneumonia within suckler systems, just under a third of the total cost is attributed to medicines, whereas the big part of the loss being due to weight loss, and also another 14% due to mortality. So therefore, by preventing disease, we're not just saving our medicines costs, but we're saving on those much higher costs that are contributing to the losses within that system. So our clients, by taking action to reduce antibiotic use in their systems, should be seeing improved profits from better health. And of course, we all need to have that discussion and that acceptance that there is increasing retailer and consumer demand to drive down the antibiotics we're using in our food production systems. And these are ultimately our customers. They're the people that define the specification of the product that we're producing. So we can borrow the 5 R's of responsible use that have been developed over a number of years through the SCOPS and the COWS principles in terms of control of anthelmintic resistance, and with a relatively sort of simple translation, consider how we could use those 5 R's with respect to antibiotic use. And really, it's looking at whether we're using the right product. So, what is the most appropriate active ingredient? It doesn't necessarily have to be what you would consider a strong antibiotic. Penicillin is often the most appropriate active ingredient for the organism we're trying to target. The right way, so what's the most appropriate route of administration? Giving a bottle of Tylan under the skin because it's convenient to give a whole bottle is not the most appropriate route of administration. They have been tested with the pharmacokinetics for the route of administration that's specified on the datasheet. Are we giving them at the right time? So, how many times do our clients need to administer a treatment, and how often is that treatment required? Are they completing that full course correctly? The right rate, which in beef is somewhat of a nightmare, because do they have an accurate body weight? Do we have a good understanding of the weight of the animals we're dosing and therefore using the appropriate dose? And then finally, the right animal, which translate less sort of satisfactorily from the SCOPS and the COWS guidelines, but really thinking about this in terms of routine group treatments, and really accepting that these are no longer acceptable. We cannot be going in and treating whole groups of animals routinely with antibiotics. So what else is happening in the industry? There's been a lot of focus on the new red tractor standards that were announced and implemented in the summer. So it's now a requirement for all red tractor assured farms to undertake an annual health performance and antibiotic usage review. And Red Tractor have produced a template. So this is the banner from the template, which they don't have to use, but it is a useful tool for structuring the discussion with the client, and it does ensure that all of the requirements of the Red Tractor scheme are covered in that discussion. And it's important in that discussion to sort of listen to the client and capture their views on antibiotic use and their systems, and challenge them a little bit, because the more time we spend talking to them, the more they actually come to appreciate that there are common goods here. So explaining that some of our highest priority critically important antibiotics are being used for treatment of babies in a high dependency unit, and therefore we need to do whatever we can to preserve the usefulness of those compounds. And taking the time to really listen to our clients about why they're doing things the way they do, and what sort of barriers may exist to them changing their attitudes and the products that they're prepared to use on their farms. The other thing that comes through very strongly from the farm assurance are the standards relating to these highest priority critically important antibiotics, the HPCIAs, and they've adopted the European Medicines Agency definition. I know there's various discussions around what should and shouldn't be on that list, but at the moment, what's on that list are the third and fourth generation cephalosporins, the fluoroquinolones and colistin. And these can only be used on red tractor farms if their use is supported by a report written by a vet showing either sensitivity testing and or diagnostic testing. And therefore the bar of evidence required to use these on a beef unit is quite high. So looking at these in more detail, clients can sometimes find this a little bit bewildering. There are 78 different brand names now for the various critically important antibiotics in cattle, but there's actually only 7 antibiotics across those 3 classes. And on a beef system, the majority of those are probably only going to be the fluoroquinolones, potentially ceftiofur. So there's not too many that they need to get their heads around. And it's really stressing to them that these are essential antibiotics in human health. And actually, it's very difficult to justify their use at all on most, if not all, beef units. So this is an intentionally provocative slide, asking ourselves whether we are being responsible. So at the top here, you can see a screenshot from a very well-known internet pharmacy. And you can see I've clicked from the home page onto animal medicines, dairy and beef, and I've clicked on foot care, and I've clicked on foot bathing, and at the top of the page that I've clicked on, I'm being advertised erythrocin sulfate powder, an oral solution for chronic respiratory disease, being actively advertised for the use in foot baths. So there's clearly a way as an industry where we have to really look at poor practice like this. And then here we've got a screenshot from a health plan that's no longer in place, but it's referring to in-milk antibiotics. And you can see here, these will be given continuously in milk whilst filling the unit to finish 5 days after the last calf enters the shed. So if you show that to researchers outside the veterinary industry, there's a sort of an audible intake of breath, especially when you talk about the use at the rate of 1 level dessert spoon per 4 calves. So these are things that don't reflect well on our industry. Hopefully these things are not happening anymore. These screenshots are a little bit old now, but we do need to continually ask ourselves whether what we're doing is responsible, and if it was looked at by somebody from outside of our industry, whether they would consider it responsible. So just spending a bit of time now focusing on specific beef systems. So looking at the beef from dairy system, I think for most of these slides there's going to be no prizes for guessing what the top drivers are going to come out as. But if we look at treatments per 100 calves, so this isn't milligrams of antibiotics, this is simply the number of times you've administered a treatment. So it's quite a large data set that we pulled together here. We've got calves here that were reared on the dairy, and this is their lifetime usage. And then here we've got calves that were reared on a rearer unit, and this is just the usage that they received during that 16-week rearing period. So we are comparing apples with pears a little bit here. But with calves that were reared on the dairy, within the data set we've looking about 11 treatments over the entire life per 100 calves for gastrointestinal disease, around 15 over their entire life for respiratory disease, and 4 for various other miscellaneous conditions. If we look at usage on the rearer unit, or units, sorry, it's a number of units in this data set, we're looking at around 40 treatments per 100 calves for gastrointestinal disease over just a 16-week period, and 130 treatments per 100 calves for respiratory disease. So In terms of immediate action as an industry in beef from dairy, when we're looking at these sorts of treatment rates, we need to be continually reviewing our hygiene, respiratory disease risk factors, and the use of our vaccines. We need to be looking at our milk feeding practices. Are we ensuring that calves are receiving sufficient milk solids? It's a big area of discussion in heifer rearing, and one could argue that is a beef from dairy calf physiologically that different to a dairy heifer? We really need to stop using antibiotics for diarrhea unless we've got a confirmed salmonella diagnosis. And a real reminder here that paramycin is an antibiotic and it's not licensed for either the treatment or the control of cryptosporidium. We shouldn't be using the fluoroquinolones for Mycoplasma infections unless that's supported by some robust farm-specific diagnostics. And really, there should be no rearers anymore that are accepting calves that are not BVD guaranteed negative, either by tag testing or from accredited dairies. In terms of longer-term objectives for the beef from dairy system, we should be encouraging our clients to build relationships with source dairies. So can we get better colostrum and vaccine management on those dairy farms before the calves leave? Can we limit the number of source dairies in a batch? If we can have 4 or 5 dairies, that's a lot better than having 15 to 20 dairies providing calves into a single batch. What can we do to improve buildings? And what can we do to limit the stresses associated with and the number of transitions? So can we reduce travel times? Can we minimize group mixing? And one thing we found quite successful in the systems we're working with, can we do more to match the diets before and after transport? We know transport's stressful, so why have that occur at the same time as a stressful diet change? If we can have some communication between the source and the purchaser, if we can match that diet during that transition period, we often see improved health and performance. More philosophically, and perhaps one for discussion during the questions, we have to ask ourselves the question, just like all the sectors are having to ask themselves the questions, are systems that rely on routine group antibiotic use, so for example in milk antibiotics, really going to be sustainable and acceptable in the medium to long term? And if the answer to that is no, what do we need to do with calf rearing systems, and how do they need to evolve to move away from routine group antibiotic use to control respiratory disease? So what about suckler systems? Well, it's much harder to get at decent sized data sets to unpick what's going on, but I think there'd be no prizes for guessing that respiratory disease and diarrhea outbreaks were the major themes that have come out of structured interviews that we've had with suckler producers. There are a few things that came out locally with some of the guys we spoke to up in Scotland. Again, some of these practices may be very regional, but we were surprised at the number of units that reported using routine antibiotic injections given to all calves at birth. We were also surprised to find out some beef units giving dairy antibiotic dry cow tubes to suckler cows at dry off. Other things that come up, sort of use of antibiotic foot baths to control digital dermatitis, and then use of antibiotics in the control of and treatment of things like New Forest eye. So again, a lot of the immediate actions for the suckler system are not that different to the beef from dairy. If we improve hygiene and look at respiratory disease and vaccine use, we can make some progress. BVD, of course, is going to crop up again in Scotland. We're now moving towards BVD freedom. I don't think any of the clients we work with are now no longer classed as not negative. There's a few things I think just need to stop. We should not be using dry cow tubes in suckler cows. We should not be giving all calves injections of antibiotics at birth, and we should not be using antibiotic foot baths in beef systems. So again, going back to some of the points we made on the previous slides, avoiding the use of antibiotics in diarrhea unless there's a laboratory kind of diagnosis to support their use, and again, avoiding the use of fluoroquinolones for Mycoplasma infections. So longer term, in terms of working with our suckler clients, what can we do to monitor and improve, if required, colostrum antibody passive transfer in newborn calves? And I'll show a bit of data around that in a second. Again, looking at stress, what can we do in terms of low stress weaning? And can we avoid those abrupt diet changes? Again, also what can we do with buildings? And can we use what medicines records that may or may not exist on the farm? If there's a diary with just some ear tags of calves that were treated, we're often doing very well. But if that data is available, what can we do? Well, we can pull it into a spreadsheet, and we plotted out the treatments for one of our largest suckler producers for their antibiotic use in the first month of their calving block. And you can see here coloured in sort of a light aqua colour the calves that were treated based on the day that they were born. And actually this farm were treating a third of all of their calves with antibiotics during that first week of life. So that sort of stimulated a bit of discussion, investigation on the unit. There were no sort of obvious clinical signs on this, there's no obvious pattern to the clinical signs on this unit. So we sort of went in, we did a number of things, but one of the things we did was to blood sample to look for signs of poor colostral antibody transfer. And these are the ZST results for this farm. And we got a large number of randomly selected calves, so not sick calves, coming up with low ZST scores, and some of them very low, 1s, 0s, 9s, 2s, 4s. And once we sort of addressed the poor passive transfer in this unit, we found antibiotic use reduced around threefold on this particular unit. And just to sort of finish off, thinking about those growing and finishing systems, in systems where these have been benchmarked and we've looked at the antibiotic use, many units can achieve pretty much negligible use. So they're using a little bit of oxytetracycline for the odd animal that gets pneumonia or the odd animal that will get foul in the foot, let's say. But many of these systems, when they're managed well, can achieve negligible use. And again, no surprises that respiratory disease is the predominant driver of antibiotic use in these systems. And this is really about engaging with the clients that are struggling about an integrated respiratory disease management program on their farms. So adopting risk-based vaccination, looking at the buildings, wherever possible, making sure those vaccine courses are completed, ideally 2 weeks before they're moving or housing animals. And that can be tricky, but we have had producers that have actually gone to the farm that they're going to buy animals from and vaccinated them on that farm and then come back and pick them up 2 weeks later. Again, coming back to the diets, if we can avoid a diet change around a transport, then that's going to be beneficial. Something we're terrible for in the beef system, and you talk to a pig producer and they think we're barking mad, but we should be adopting and maintaining batch systems. The poor batch discipline that we see in the beef sector is a major risk factor for respiratory disease, as is mixed age groups and of calves in the same airspace. And what else can we do to limit stresses? Can we improve our handling systems? Are we putting animals under stress with restricted access to resources like feed and water? And what can we do to control other diseases in that system? So things like coccidiosis and in animals that are coming in from grazing, fluke and gastrointestinal nematode burdens as well. So in summary, we've sort of all got to come to realise antibiotic resistant bacteria are a major concern both to human health and to animal health, and that these routine group treatments are no longer acceptable. So we're encouraging our clients to put in place clear treatment protocols with their vets, to talk to their vets, to engage their vets in those discussions. Investigating disease problems thoroughly to look at the risk factors and look at ways that we can drive down disease in those systems, and doing that through good husbandry and biosecurity, controlling diseases like BVD, and excellent colostrum management for those systems where we're seeing where we've got young calves within our system. So that's the slides, and I'll hand over to Mary, who'll hopefully be able to manage questions.
That's great, Alex. Thank you very much for that. Right, we've got a few questions already, but do take the opportunity now to type in some questions in that little box on the right-hand side of your screen. I just remind you again about the opportunity to work with us to host some farmer meetings over the winter using this slide pack as a basis for that. We're going to actually perhaps put in a few extra slides that might be more targeted to what the messages that farmers want to talk about, some of those practical things that they can do now to help them be more responsible in how they use antibiotics. So if you would like to get some more information about what we're looking for in those meetings, then do email brp@ahsdb.org. at ahdb.org.uk, and we can send you a bit more information about that. Right, so now I'll have a look at these questions. So the first one is just about clarifying which list we're using for high priority, critically important antibiotics. Is it the EMA one or is it the WHO one? Because there seems to be some confusion in the industry about these.
Yeah, so that's easy to answer from the industry perspective. It's the EMA definition that we're all working to. Yes, there is the WHO list, and when you read the WHO list, you're not really left with any antibiotics at all. So we're working with the EMA one. The one thing just to be aware of, there are certain retailers that will include macrolides on that list in addition, but in general, the industry is sticking with the EMA list.
Okay, thank you. The next one is a question close to my heart. It says, this vet has made a spreadsheet for an antibiotic review for dairy systems, but is struggling with how to calculate the average mass for a beef system of population at risk, I suppose is what we're talking about. And I know AHDB are working on this, and Alex is helping us with that. So I suppose it's work in progress, Alex, isn't it? But have you got anything else to add to that?
Yeah, it is a work in progress, and we sort of intentionally didn't touch on that here because we didn't want to bog down the message to clients and farmers. I think in terms of driving discussions with farmers, we tend to use a lot more the actual treatment numbers because that helps us to define the proportion of animals that have needed treatment. I appreciate that's very different to what we're looking at an industry or a national level, but in terms of driving conversations with clients around disease control, getting away from MIGs per kg can be useful because it allows us to really understand numbers or proportions of animals treated, whilst also not encouraging perhaps them dosing animals every other day or half dosing them to get their MIGs per kg number down. In terms of answering the question more directly, the Esk Vac calculation that we talked about a lot in the past is what's produced at the national level, which will continue to be produced so the UK can compare itself to other countries. But the real stickler for me with Esk Vac and for a number of other people is it doesn't include the cow in its calculation. So I think if you are going to do MIGs per kg and you want it to be a fair comparison with other sectors like dairy, then you do need to include the mass of the cow in that. And the way we're doing that at the moment, we're putting animals into broad categories, so animals that are adult, sort of between 1 and 2 years or under a year old, and taking an average weight for that system and sort of the average number of animals on that farm over a year, and using that to create a relatively crude kilograms of biomass. But there are a lot of discussions, as Mary's alluded to, ongoing with really trying to nail that down for the beef sector.
I would just add to that, the Cattle Health and Welfare Group is working with the VMD because it has a sort of antibiotic working group, and it is going out to consultation about the benchmarks that it's going to recommend at a farm level for dairy very soon. And then after that, and after some work that we're working on with a research provider, then we will follow up with some work on beef farm level benchmarks. So it's a very active area, and it is something that we're thinking about, and we're very keen that the whole industry does use these same metrics to avoid confusion, but it's we haven't quite got there yet, especially on the beef side. So let's just look at this one. Oh gosh, I've whizzed down the list now. So dry cow tubes, what would you recommend for beef herds which are having trouble with summer mastitis? I have a herd with big trouble despite adequate fly control over the summer.
So are we presumably we're talking about an autumn calving herd that are dry in the summer and they're tubing them to avoid summer mastitis? Really it is a tricky one, but I just don't think we can be using antibiotic dry cow tubes. So we can use we can use the non-antibiotic teat sealants. We can do as much as we can for fly control. It was something I didn't expect to see. I was quite surprised when I saw it come through in the data we collected. But blanket, dry cow, antibiotic dry cow therapy in suckler systems, I think is very difficult to defend.
Okay. Would you encourage vets to have a discussion with farmers at the annual review that's required for farm assurance? And is that a great opportunity to find out about other things that are occurring on the farm?
Well, that's really, if they're farm assured, then that's really where that document's heading, and it's quite a nice template to use, and it does help to drive that. And I think the main message from having spoken to some people that have used it is just taking that time to listen to them a little bit, and capturing what it is that's driving them and what they think about it, and using it as an opportunity as much for us to listen to them as much as us sort of tell them what we think they should or shouldn't be doing. And I think if we can understand the drivers of their behaviour, we stand a better chance at helping to move behaviour in the way we'd like to.
Okay, so the next one, I'm not sure I'm going to get this quite right, but what are your thoughts about the extent of reverse zoonoses and its importance for animal health and antibiotic use?
Sorry, say that again. You just broke up. The importance of
reverse zoonoses.
Okay, so I'm guessing from the question that we're talking about the transfer of pathogens or antibiotic resistant organisms from humans back into animals, and how important that is. And that's been shown. There's some quite nice work that's come out of Roslin looking at MRSA in that respect, and how it jumps from one species into another and then back again. And that's been shown between sort of pigs and humans. And I think also with cattle, it's been shown to come back as well. So it is clearly important. Yes, biosecurity works in both directions. So yes, it's important. It's something that is an area of ongoing research. In terms of the way the sort of work that gets done in the field, of course, there's a lot more money in human research, and therefore that kind of drives the research agenda somewhat. And also, a lot of the studies have looked at clustering of resistance and sort of the direction of travel. And if you've got, probably this more applies to pig systems, for example, but if you've got a lot of antibiotic use at a very focal point that's going into the animals, then you tend to find a lot of resistance in the humans that work with those animals, and then dropping off levels of resistance the less associated you are with the farm. So it depends where the point source is of the generation of resistance. To kind of express it a different way, you tend not to get many cows that close to a hospital that may be picking up resistance from that point source. But in the same breath, with MRSA, we have seen transfer from humans back into animals. So it's certainly important. It probably doesn't get as much attention as it should do because of the way science is funded. And I just say general biosecurity works in both directions. In terms of dairy, if you're wearing gloves when milking a cow, you're mainly doing that to protect the cow. So yeah, it's important, and we probably don't look at it enough. Okay, so just one from me then. So there are calf rearing units out there that are doing blanket treatments of antibiotics, and I'm guessing that the prospect of not doing that is quite scary because they think the calves will get ill, which I think is a sensible risk. How do you suggest that farm and vet work together to work towards or moving away from that sort of scenario? Yeah, so it is difficult, and I think that's really the one area in beef where we've really got to focus our efforts on coming up with a better solution. In terms of the day-to-day practicalities of it, I don't think we should be having health plans anymore that say if a certain proportion of the group gets sick, automatically put this amount of in milk antibiotics in. I think there needs to be that direct oversight by the vet who's in charge of that farm. So it should be more that if you have a problem with respiratory disease in calves shortly after arrival, you need to call us, you need to talk to us, and we'll make that decision together as to whether we're going to put the antibiotics in the milk and for how long that's going to happen. That way the vet's continually involved in the decision, the vet knows it's happening, and then they can then start to drive those discussions around what we can do in the longer term to move away from having to do it. But I'll completely sort of accept, Barry, yeah, we have a lot of very well run calf rearers that just cannot get on top of respiratory disease in those calves in that first 3 to 4 weeks on arrival without some degree of group treatment. But it does need to be under direct and continuous consultation with the vet. It can't just be automatically going into that system for 4 or 5 weeks at a time.
Yeah. Okay. So we have another question about it's about the red tractor guidelines and use of high priority critically important antibiotics. So do you have a practical interpretation of the limitation of when CIAs can be used based on red tractor guidelines? In our practice, we feel it has variable interpretation. Is culture and sensitivity for each individual animal, for each individual condition, the interpretation?
So that's quite an extreme interpretation. I think generally you need to be comfortable that you've got a really good case to use them. So if you are a relatively closed system and you've done some diagnostics and you've shown that you do have resistance to such a degree in the pathogens that are causing problems in that system that you need to use a fluoroquinolone, then I don't think you're going to need to do culture and sensitivity on every animal that gets sick. You're dealing with a closed system, you've established resistance. You should probably do some periodic audit to make sure that that's still the case on that unit. Periodic, what does that mean? Well, maybe you should be checking that once a year. But you've already built a strong case within a closed system. If you're a calf rearer that has very good batch discipline that completely depopulates after every batch, and you have one batch where you've had cultural sensitivity saying that you need to use a fluoroquinolone because nothing else is going to work, you can't then assume that the next batch is going to have to use a fluoroquinolone only to be effective. So it's going to be very dependent on the system you're considering, but I think you have to start from the default position that you're not going to use them unless you have a very compelling reason to do so. There is an argument, which I don't want to get in too much, but there is an argument around in vitro versus in vivo culture sensitivity to an antibiotic. And there has been some quite high profile research, not actually with fluoroquinolones, but with other antibiotics showing that genes that result in resistance are not actually expressed in vivo, and therefore those antibiotics are still effective in isolates that are actually shown to be resistant in vitro. And therefore, I do think we just need to leave the door open a little bit for those examples where there is clear clinical evidence that animals do not respond to penicillin or oxytetracycline or amoxicillin clavulanic acid, and you are being forced to use a fluoroquinolone because it's the only antibiotic that clinically works within that farm and that system. But I would expect that to be a very, very, very small minority of farms where that's demonstrated.
Okay, we've got a couple more now. So can you advise on a treatment for silage eye that doesn't involve antibiotics?
No, so oxytetracycline for the treatment of silage eye. Get myself mixed up with New Forest, but either way, no, I can't.
So I suppose you're looking at reducing the risk, are you?
Yeah, absolutely. You know, if you've got an animal that's affected, you have to treat it with an antibiotic. So.
Yeah, okay. Clinical judgment is key for animal welfare assessment. There is justification template on the red tractor site. So this must be about the red tractor assessment and animal welfare. And I'm not familiar with it, but there's a template on the red tractor site. That's the point being made here.
Okay, and I think that sort of goes a little bit to the point I was making before, in that it doesn't always have to be cultural sensitivity. You may have a very strong clinical justification for needing to do what you do, and we do need to leave that door open, certainly.
Okay. Okay, and one more about Mycoplasma. Can you advise on treating potential Mycoplasma infection, please?
So we have actually got a number of rearers that that say they find oxytetracycline can be very effective for their Mycoplasma treatment. So I don't think we should be writing off oxytetracycline just because it's a Mycoplasma and we think we need to reach for the fluoroquinolones. So I certainly wouldn't be hesitant of trying that within farms that are struggling with Mycoplasma. I appreciate that in terms of the macrolides, we've only really got tulathromycin with a license in terms of the long-acting macrolides that we have.
Right, I've got through all the questions I've got on my screen at the moment. So, I'm going to draw it to a close there. I'd just like to thank Alex very much for a brilliant presentation and answering those questions, and thank you all for participating in the discussion. So just to remind you that the presentation has been recorded and will be available on the AHDB YouTube channel, along with a number of other webinars that are there. If you want to go and have a look at that, I think a link is sent around after this when it's loaded. And if you'd like to contact us about working with us to deliver some meetings, then it's email brp@ahdb.org.uk. And if you could do that fairly soon, because we will be putting those meetings in the diary over the next couple of weeks. So all I'm going to do now is just wish you all a very good evening, and thank you very much for joining us.